Mrs. Davis. How are you feeling? The surgery went through, but I can see you are in some pain.
Surgery? What surgery? No one told me anything. I just remember them taking me in, and now I wake up like this.
Dr. Lee performed the surgery to repair your aorta. It was an emergency situation, but I'm concerned because we didn't have a chance to go over everything with you.
Good afternoon, Mrs. Davis. I see you're awake. The surgery was necessary to save your life. How are you feeling?
What do you mean necessary? No one asked me if I want this. I didn't even know what was happening.
The situation was critical and limited of time. I made a judgment call to proceed because it was the only option to save your life. There wasn't time to go into all the details.
Dr. Lee, with all due respect, informed consent is crucial, even in urgent situations. Mrs. Davis and his family had the right to understand the risk and make their own decision.
You mean to tell me you made this decision for me? I thought I had been asked that I had a say in what happens to my own body.
I understand your concerns. In the meantime, I should have taken the time to explain the situation fully, even under pressure. I truly believe I was acting in Mrs. Davis' best interest, but I know that I breached the ethical responsibility to ensure he was fully informed.
It's important to address this situation properly, Dr. Lee. Mrs. Davis, you have every right to file a complaint or seek further action. This is a serious breach of trust and patient rights.
I can't believe this happened. I'm not just a patient. I'm a person. I should have been given the chance to make my own decision. I will filing a formal complaint. This isn't just about what happened today. It's about making sure this doesn't happen to anyone else. Good afternoon, Mrs. Davis and Miss Davis. Thank you for your coming in today. I understand this is a very difficult time for you both. Mrs. Davis, we have confirmed you have a condition called aortic dissection. This is a serious and life-threatening condition that requires immediate surgery to repair the aorta.
Surgery? I've been trying to avoid that. What are the risks?
I completely understand your concerns, Mrs. Davis. The surgery is high risk given your age and history of heart disease. The risks include a significant chance of complications such as stroke, organ failure, or even death during or after the procedure. However, without the surgery, the likelihood of the aorta rupturing is very high, which could be fatal.
What about other options? Is there any other way to treat this?
Unfortunately, due to the severity of your mother's condition, surgery is the only option that offers a chance of survival. However, the decision is ultimately yours, Mrs. Davis. It's important that you understand both the risk of surgery and the risk of not having it.
I'm not sure. This is all so overwhelming. I have always been afraid of surgery, and now you are telling me it could be even more dangerous?
Mrs. Davis, it is normal to feel afraid, especially when facing such a difficult decision. We are here to provide all the information you need to make the best choice for you. This is a decision only you can make, but we are here to support you no matter what.
Mom, I'm scared too. I think you need to think about what could happen if you don't have the surgery. We need you to be around.
Take your time, Mrs. Davis. It's a lot to process, but time is of the essence. I want to make sure you are fully informed and comfortable with whatever decision you make it. If you like, I can step out for a moment so that you can discuss it with your family.
Yes, please. I need need a few minutes.
A few moments later.
I've made my decision. I'm going to go ahead with the surgery. I want to take that chance even if it is risky.
Thank you for trusting us, Mrs. Davis. We will do everything in our power to ensure the best possible outcome. I will have you sign the consent from now and we will prepare for surgery.
Thank you, Doctor.